Hello, it's Kat at Orion Billing. I make videos to help those who are doing medical billing to have a better understanding of the job and get more money in the door. So I wanted to talk about how not to lose patients. This is referring to the ways that a medical biller can really help a provider not lose patients, and a little bit of a story where this did happen to a provider that I spoke to. This was not a billing client of mine, but somebody who I did a consultation for, and he told me this story about having lost a long-term entire family of patients. The patient involved was an older man. His family had been seeing this doctor for years. The man had gotten a new insurance policy and it wasn't covering his treatment with this chiropractor, and he was confused about why it wasn't covering. The front desk didn't know how to explain it. The doctor himself did not understand it very well, and he then reached out to his biller multiple times for help, and in the end he was told, quote, "This doesn't fall under the scope of our contract." That's even a little bit hard for me to say out loud. Ouch. I really think that personally, that a biller should feel like a part of your team, whether they're in your office or they are not in your office. They are not an uncaring foreign entity. They are a professional service that you have hired to help your practice collect its money. Your income is, to whatever degree, in their hands. They need to be on your team. Hearing the story led me to think back on how I've handled this kind of thing for clients of mine. And I actually do it all the time. I spoke to a patient today in a similar situation who was confused. I would have just called the patient myself. The time that it would take me to explain an insurance confusion to the patient, how long could it be? Could have saved this doctor's relationship with an entire family. In exchange for a few minutes, I can keep a patient happy, I can keep my client happy, the doctor keeps the patient, everybody wins. Now, if the front desk staff was well-versed enough, I might also explain it to them so that they could relay it to the patient, or in the future, handle similar situations. I might draft a letter, for example, that could go into their training manual that they could then use the next time the same thing occurred. It's no mystery to any biller that many patients just don't understand their insurance very well, and also that many office staff really understand just enough to get by. Losing upset patients is a pretty big price for my client to pay for the lack of a little TLC. In my philosophy, taking responsibility for your team, and when you are a biller, even an exterior billing service for your client, you're on their team, is much easier than brushing things off that are, quote, not your job. And good customer service from a billing company can help avoid giving a bad name to practitioners and billers alike. Let me know if I can be of any help to you. You probably can get more money in the door for the work you're doing. I hope to help with that with the content in my videos. At Orion Billing, we help healthcare providers get more of what they earn. Have a great day.